Got it.
All right, awesome. See, I'm waiting for one thing because I know it's going to start making noise on my side here. There we go. Perfect. All right. Well, good evening, everybody. Thanks for joining me on your Tuesday night. I'm excited about today's topic. We're going to be talking about kind of the state of our pediatric or our children's health and some of the main medical interventions now that are recommended for them. The first, none of this is personal medical advice, just hopefully some interesting information to discuss and go over. I'm going to share my screen here. Oh, I just got to swap these. All right, perfect. So without further ado, I am Laura Buchanan. For those of you who do not know me, I'm board certified in family and obesity medicine. I'm a metabolic health practitioner, and I'm also certified through the Menopause Society. And today we're going to be talking about lifestyle, GLP-1 medications, and bariatric surgery for children. We're going to start by talking about the prevalence of disease in children. Then we're going to discuss a pretty cool study that came out recently on the impact sugar intake can have in the first 1,000 days of life. And then we're going to review different treatment recommendations that I just mentioned, which is lifestyle, medications, and surgery for children with obesity. Currently, the prevalence is about 20%, which is over 14.5 million adolescents. And the prevalence of fatty liver disease is about 10%. When you look at children who have obesity, the prevalence goes up to 40%. Just a few decades back, this was something we exclusively saw in adults. A few decades further back was primarily only seen in people who drink a lot of alcohol. And the prevalence of prediabetes is up to 20% now, and over 30% in teenagers who have obesity. Okay, so let's talk about sugar, where I think whereas a lot of those medical conditions that we just saw in those to me, when I first started seeing some of those statistics around children, was really surprising. And this was a really cool study where they looked at exposure to sugar rationing in the first 1,000 days of life. So that's from conception until age 2. And current guidelines, which I think we all agree on, is at least up until the age of 2, there should be 0 grams of added sugar to a child's diet. And the other really kind of shocking thing I read was that pregnant and lactating women consume on average 80 grams of added sugar per day. So this experiment is actually what we call quasi-experimental, but it basically took advantage of a natural experiment resulting from the abrupt release of sugar rationing associated with World War II in the UK. Other food groups were also rationed and then released at different times, but sugar was the only one to rapidly increase in consumption after the end of rationing. Using the UK Biobank data on people who were or were not exposed to sugar rationing in utero and early in life, so the first 2 years, the authors demonstrated a protective effect of this rationing against the later development of type 2 diabetes and hypertension and obesity as well. And what this shows is you can see very clearly when they ended sugar rationing, the amount of calories, the percent change of increase in calories that were coming from, or the percent change of increase in sugar consumption went up almost 40% once sugar rationing ended initially, and then it just continued to rise. What these graphs here are showing is that the longer the individual was alive during the sugar rationing period, so 1,000 days, that would be their in utero plus 2 years, you can see they had the lowest risk for developing type 2 diabetes later compared to just rationing in utero, and then compared to no rationing at all. And same thing for hypertension here. And this is basically showing kind of that same thing where there is still benefit if you only were rationed against sugar in utero, but the longer that you were rationed from sugar, the benefits just continued to accrue over time. So I won't read this whole thing, but exactly what we just said, rationing restricted sugar intake to levels within current dietary guidelines found that early life rationing reduced type 2 diabetes and hypertension risk by about 35 and 20%, and delayed disease onset by 4 and 2 years, respectively. Additionally, in utero sugar rationing alone accounted for about 1/3 of the risk reduction. So that was something that was really interesting, and just thinking about our current day food environment, and that pregnant and lactating women are getting 80 grams of added sugar per day. And that's something we clearly need to be educating people on a little bit better. They also found a 30% reduction in the risk of obesity with this study, and they did not see any difference after butter rationing ended a year later. So they tried to control for that as well, to see maybe fat intake changed, and then that also increased these things, but there was no difference there. They also controlled and looked at other diseases that would be less likely impacted by sugar intake to make sure there's no confounders there. And they did not find a difference between more and less sugar. So with that, and keeping in mind that sugar, and many years later, the impact that it still seems like it potentially could have on these people's lives, we're going to transition and look at modern day interventions to decrease diabetes and metabolic disease risk. And the current plans to turn the metabolic tide are plant-based nutrition, medication, and surgery. New York City's school system, which is one of the largest in the country, has implemented vegetarian Mondays and vegan Fridays. They go on to say that plant-based meals are rich in vitamins, minerals, fiber, and protein. Plant-powered Friday also exposes students to meals prepared in different flavorful ways, encouraging students to make healthy food choices for a lifetime. And many of those things I do agree with. However, when we look at the foods here on the right that are actually part of their daily offerings, they've got low or fat-free milk. We don't know what the grab-and-go breakfast pack is, but they've got fresh fruit and canned fruit, which typically has lots of sugar added. They've got shredded wheat, multigrain oats, toasted oats, oat circles, which again is all very high carb, very low protein. And we go look at some specific days. Egg and cheese on a bagel, not horrible. I like the egg and cheese. Seasonal fresh fruit, that's good. And then on Friday, they've got, again, bagels served with some cream cheese and jelly or peanut butter, oatmeal, and seasonal fresh fruit. Now, what New York City is doing by having these vegetarian Mondays and vegan Fridays is they're basically doing another natural experiment like what happened in World War II. And it's possible many decades from now, we're going to look back at these vegetarian and vegan school meal days and see negative outcomes. We really don't know, because it's an experiment on our kids. There's no data that they are pointing to say we should actually be putting our kids in a vegan and vegetarian environment for benefit. I want to highlight as well here, because it is vegetarian, they are able to have fat-free chocolate milk with 25 grams of added sugar, but they don't want the kids to have whole milk because of the fat content. And here we look at the UC Davis Center for Nutrition in Schools. They comment regarding chocolate milk that although it contains 25 grams of sugar, this is unlikely that this relatively small amount of added sugar contributes to dental caries or childhood obesity. But maybe the combination of a bagel with jelly or seasonal fruit or oatmeal with the chocolate milk is actually contributing to childhood obesity and those statistics we saw at the very beginning. And if you ask me, I would much rather give my son eggs and whole milk for breakfast rather than oatmeal and chocolate milk. So let's look at the plant-based, a new paper that just recently came out on looking at these plant-based diets that are now being advised to our children very often, and see what the major medical societies across the world have to say about it. So the German Nutrition Society says adolescents should not completely stop eating animal products as a permanent dietary pattern. The French-speaking Pediatric Hepatology, Gastroenterology, Nutrition Group says a vegan diet is not recommended for infants, children, and adolescents due to the inevitable risk of multiple nutritional deficiencies without supplementation. The European Society of Pediatric Gastroenterology, Hepatology, and Nutrition says indeed, self-planned dietary patterns may lead to severe consequences, including irreversible cognitive impairment and death. The vegan diet is not recommended during the first 2 years of life. Another society, many societies actually in Italy, said a vegan dietary pattern should not be recommended for children under 2 years of age due to the possible macro and micronutrient deficiency linked to these nutritional habits and consequent growth and neurodevelopmental delay. A systematic review back in 2017 said the existing data do not allow us to draw firm conclusions on health benefits or risks of present-day vegetarian type diets on the nutritional or health status of children and adolescents in industrialized countries. So my takeaway is we don't have data. We should not be experimenting on our children. If we want to have some controlled experiments, then I think we need, do some experiments, but do not just start implementing and pushing vegan and vegetarian school lunches or school breakfasts days on our kids without it. And something we're going to look at that everybody agrees on if you are doing a vegetarian or vegan diet is that supplementation is required and daily supplementation is recommended. When you look at the potential nutritional deficiencies for comparing omnivores versus vegetarians versus vegans, so people including meat in their diet, you can see that across the board, the vegan diet has the most number of subjects with deficiencies, followed by the vegetarian, and then followed by the meat eaters. So again, if we're trying to put our children or recommending kids who are going to school and maybe they're getting most of their nutrition actually from school provided food on vegan or vegetarian diets, now we have to think about, okay, are we giving these kids supplements? Are we giving every single kid a B12 supplement if we're recommending them to go on a vegan diet? And then are we actually not only recommending that, but then are the kids taking that supplement on a daily basis? Knowing myself and how hard it can be to take supplements on a daily basis, I think about it in kids, it's even more difficult. Now let's go back and look, what does the American Academy of Pediatrics say about vegan diets? So that paper we just looked at was brand new. This paper was released back in 2004, and really there has not been a lot more since this paper was released from the AAP on their stance on vegan diets in infants, children, and adolescents. What they said is that some people believe that patients following vegan or vegetarian diets suffer from nutritional deficiencies. Some people, it looks like, are numerous national and international organizations. Although there have been case reports of children failing to thrive or developing B12 deficiency on vegan diets, these are rare exceptions. Multiple experts have concluded independently that vegan diets can be followed safely by infants and children without compromise of nutrition or growth and some notable health benefits. Again, I would like to see the studies and the multiple experts that they cited here. It would be nice if they included more citations in this paper. What's interesting is in this same paper where they just said it is safe, this is also what they say in that paper. There have been case reports of B12 deficiency in exclusively breastfed infants of vegan mothers, and for this reason, supplementation of all breastfed infants of vegan mothers is recommended. Additionally, DHA is found in high concentrations in the brain and retina, and there's evidence that early dietary intake of DHA is associated with superior developmental scores at milestones. Breastfed vegan infants have lower erythrocyte DHA levels than breastfed infants of omnivore mothers. And failure to thrive in vegan infants usually is due to the use of homemade formula in the first year after birth. Parents should be cautioned that soy milk, rice, nuts, seed milk, non-dairy creamer, water-based cereals, mixtures, juices do not contain sufficient vitamins, minerals, or nutrients for their baby. And so infants can be started on fortified full-fat soy milk at 1 year of age. That should actually be supplemented with human milk or a soy-based formula. They go on to continue that zinc supplementation may be necessary. Additionally, you have to be cautious that there could be insufficient energy intake, protein, vitamin, and mineral intake. There can be issues with energy deficits because the diet is low in energy density, meaning low calories, but very high bulk with the foods. And they actually said because of this and the potentially risk for too much fiber, that choosing refined instead of whole grains and peeling fruits and vegetables could reduce the fiber content and be an option. Additionally, look out for calcium, and this continued to go on. We won't belabor it any further, but they mentioned this for vitamin D, riboflavin, and iron as all potential nutrients that have been shown for intake to frequently be low in vegan diets. So Additionally, when they've done studies, they found that many children or teenagers who do opt to choose a vegetarian or vegan diet, some people are concerned it could mask an eating disorder. They're choosing to adopt this method as a method of weight control. This is just something to be on the alert of either a parent or a physician if someone is adopting that diet, to make sure that's not an issue. And I want to remember that initial statement at the beginning of the paper where they said some people believe patients following a vegan or vegetarian diet suffer from nutritional deficiencies. And yes, there have been case reports. However, these are rare exceptions. The entire paper is then spent on talking about the potential deficiencies. And we just now looked at a more recent paper that, again, brought up by numerous organizations sharing the same concern about all of these deficiencies. So keeping that in mind, what does the American Academy of Pediatrics say about low carbohydrate eating patterns for children with type 1 diabetes, type 2 diabetes, and obesity? And real quickly, so that paper in 2004 was for all kids, including healthy kids. This paper is specifically for kids who have a disease or are at risk. And so oftentimes in the case where you're trying to improve or reverse a disease that is already present, sometimes there's a little bit more leeway of there could be a side effect from that intervention. Now, in this paper, they say, however, there are concerns about the use of these overly restrictive dietary patterns for growing children and adolescents, including growth deceleration, nutritional deficiencies, poor bone health, and disordered eating behaviors. They go on to say, and actually first, so overly restrictive dietary pattern is what they're calling a low carb diet, yet veganism and vegetarian gets a pass, is a great option, great dietary pattern that is not overly restrictive. Being a little sarcastic, I would question that. They also go on to say that there are 14 different labs with 5 different blood draws over the first year on low carb if a child and their family decides to start eating this way. Additionally, they want a DEXA scan performed, a bone density test, if they're eating this way for 2 years. We do have an entire another talk on this paper, and actually we published another paper kind of countering the different points that they brought up about some of these concerns and the necessary lab draws and the so I'd encourage you to go check out that paper if you'd like a lot more in depth about some of the flaws in this paper that they published. And I just want to take a second, look at the stark contrast here and how plant-based nutrition was supported, whereas the low carb eating was medicalized and called an overly restrictive dietary pattern. When I look at these foods right here, this does not look like an overly restrictive dietary pattern to me. And I also don't think if someone or a child is eating this way that they need to have 14 different blood tests with 5 different blood draws done over the course of a year. Now, with that, I'd like to transition from the nutritional approach to medications and surgery. So this was a practice guideline recently published for the evaluation and treatment of children and adolescents with obesity. The consensus recommendation is that you may offer children ages 8 through 11 years of age with obesity, weight loss pharmacotherapy according to medication indications, risks, benefits as an adjunct health behavior and lifestyle treatment. Additionally, new evidence may lead to additional options for children younger than 12 years in the near future, which we're actually going to be looking at a paper that was recently published using the weight loss medication GLP-1s in 6 to 12-year-olds. On weight loss surgery, they say these studies suggest that weight loss surgery is safe and effective for pediatric patients in comprehensive metabolic and bariatric surgery settings that have experience working with youth. And they are talking about both gastric bypass and sleeve gastrectomy, which we'll talk a little bit about more, saying they're both commonly performed in the pediatric age group and result in significant sustained weight loss, which is true. They are effective. However, I think the safety part is something that I would argue potentially against, and we're going to spend a lot of time looking at. First, we're going to talk about liraglutide for children from 6 to less than 12 years of age. So that is one of the GLP-1 medications. These are things like Ozempic, Wegovy, Mounjaro, Zepbound. And What this study did is it was a 56 week, so a little bit over a year period, where they were giving once daily injections of liraglutide plus lifestyle interventions. And they compared that to a placebo plus lifestyle interventions. What we can see here at the top of this graph is the BMI did drop significantly for the children on the liraglutide, and they maintained that and they did very well. In the group that was getting just really the lifestyle interventions, you can see that actually as the time progressed, their BMI increased. When you look at the change in body weight initially dropped for the liraglutide group, and then it did go up, which is a good thing actually. So we want to see in children that although the BMI is coming down, which is good, they're actually still gaining weight as they are still growing and getting taller. So that's a good thing. And here, the placebo group, we can see they just continued to gain weight. And again, their BMI did continue to go up. So the lifestyle intervention in this study was clearly not effective. When we look at the adverse events, we see that there is 80% of individuals compared to 50% of individuals in the placebo group had GI side effects, and 12% had serious side effects versus 8% in the placebo group. 11% of the kids in the liraglutide group stopped the medication due to side effects, and 3 serious events were reported due to the medication itself. 2 of those were severe vomiting cases, and 1 was colitis or kind of inflammation within the colon. And additionally, 2 were started on proton pump inhibitors, which to help with some of their side effects, which those medications increase risk for micronutrient deficiencies, osteoporosis, pneumonia, and more. So we can see it was very effective, but we're seeing more complications, and we're seeing that more medications are being required to help mitigate the side effects from this medication. And it's not uncommon to see prescription cascades like this. Another medication I didn't mention that someone was started on was an anti-nausea medication. All right, so moving past the medications, let's look at some of the surgical outcomes. And the 2 surgeries here that were performed was the sleeve gastrectomy, which is here on top you can see, and then the gastric bypass, which you're basically bypassing the stomach and part of the small intestine to decrease the nutrient absorption. And what they found after 3 years in a little over 200 adolescents, they did lose significant amount of weight. And just for their baseline characteristics, to give you some reference, the average age in this study was 17 years old, and their average BMI was 53. So that would be someone who is 5 foot tall, weighing 270 pounds, or someone who is 6 foot tall, weighing 390 pounds. I also want to acknowledge that they did end up putting type 2 diabetes into remission in 95% of the kids that had this surgery, and 75% of kids that had the surgeries, blood pressure improved, as well as their weight-related quality of life improved. But it's these side effects and these much longer term effects that we really don't know yet, because we don't have enough long-term data, that I'm more concerned about than the deficiencies. So within 3 years, 57% had iron deficiency, 13% had vitamin A deficiency, 8% had B9 and B12 deficiency. B12 deficiency can lead to permanent neurologic deficits and complications. And these are deficiencies that we're seen in adolescents who are being monitored very closely, and probably, I'm sure, were being recommended to take their vitamins on a regular basis, and they're still having this percentage of nutritional deficiencies. Additionally, this was in just the vitamins that we were checking. We don't know with all the other vitamins that are out there, are there other deficiencies too that they're missing? The other big thing is that 13% needed 1 or more additional surgeries. That's 1 out of 8 kids. And that was 47 additional surgeries during this 3-year time period occurred. So this is where, yes, it was very effective, but if you need to do 47 additional surgeries after the initial surgery, I question the safety of that. We then go look at 5-year outcome data, so a little bit longer. They did maintain a 26% decrease in body weight over 5 years, which is awesome. At 5 years, however, they had 48% iron deficiency. 30% of the individuals needed additional surgery within 1 year, which came up to 46 additional surgeries for 32 adolescents over 5 years. And then there were 3 deaths as well. One of the deaths was attributed to sepsis or a really bad infection in an individual with type 1 diabetes. And then the other 2 deaths, tragically, which occurred 4 years after surgery, were consistent with overdose. In adults that they were comparing these results to, there were 7 deaths out of 400 adults that they looked at, 3 of which were related to gastric bypass and occurred within 2 weeks of the surgery. 2 were unknown, and 1 was death by suicide. What is really, I think, important to think about those 2 kids that passed from overdose is in studies in adults, what they have found after bariatric surgery is a significant increased risk in substance use. And so the alcohol use goes up from 8 to 20%, and the new onset substance use of different drugs goes anywhere from 35 to 90% increase in new users. And so it's hard to say if those children were using previously, but at least in adults, we know, unfortunately, it is a huge problem that after bariatric surgery, new substance use becomes an issue. One more thing I want to look at is comparing surgical and medical therapy for type 2 diabetes. And so this study looked at 30 adolescents who underwent a gastric bypass or some type of surgery, and 63 who underwent medical management. The medical management was from the Today study, and that study compared metformin monotherapy to metformin plus rosiglitazone or metformin plus lifestyle interventions. And the lifestyle intervention, which we'll talk a little bit further about just a couple slides down, was encouraged a calorie deficit with increased physical activity and the traffic light diet, which again we'll look at in just a second. After 2 years, what did they find? 23% of adolescents undergoing surgery required a second surgery. They did find great success from a diabetes perspective. A1C went from 6.8 down to 5.5, whereas in the medical therapy group, unfortunately, it went from 6.4 to 7.9. Additionally, as you can see, the BMI changed there. They continued to gain weight over the course of the study. And 50% of the teens with type 2 diabetes required insulin therapy after just 11 months of their medical intervention and their lifestyle recommendations. So let's take a look at the traffic light diet, which they were advising kids to eat, that did not seem to be effective in this study. The green is the list. You can eat daily, whole grains, fruits and vegetables, healthy proteins, and some dairy products. Slow, eat only once or twice a week. You can see refined grains, lean or ground meats, sugar, and then only eat once or twice a month. There are desserts, fried foods, and processed meat. The red foods, they would also, many of the foods that were put into that red category were foods that had 5 grams or more of fat as well in them. So my big question, and what we really need to look at further, is we see in children with obesity, with type 2 diabetes, recommending whole grains, eat daily fruits and vegetables, clearly was not very effective. And they recommended against red meat, red processed meat, and other ground meats, and foods that contained 5 or more grams of fat were, again, that were put into the red category. So maybe it is the nutritional intervention that we keep on trying to test over and over that is really failing our pediatric population. So looking back at the beginning, I want to think about future directions here. Obesity prevalence is almost at 20%, over 14 million youth, fatty liver disease, over 40% in children with obesity, and prediabetes over 30% now. And this is actually from one of the surgical papers, but they said because of the substantial increase in the occurrence of type 2 diabetes in the pediatric population and the medical complications of this condition, therapies are urgently needed that will achieve better glycemic control than standard medical management. Medical management in youth is focused on combining lifestyle intervention and pharmacologic treatment, but these therapies have yet to demonstrate improvements in disease progression. And I agree. Looking at those studies, our lifestyle interventions are not being effective. We have to change what we're doing. If we go look at the American Diabetes Association report from 2019 and beyond, They have stated that reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. And this is where I really would love and like to see some research going, is could we help these kids that have prediabetes, that have obesity and fatty liver disease, help them in the exact same way that we're helping our adult patients. And we're seeing a ton of success, tons of studies coming out that the ketogenic diet is wins out in the Mediterranean diet and decreasing diabetes medications, improving A1C. We see the ketogenic diet in another study in adults beat out the DASH diet, which is the main diet that is recommended for blood pressure. Ketogenic diet beat that diet. And so I think we really need studies evaluating a low carb approach in children. And with that, I'm going to open it up for some questions and discussion.
I saw a couple in there, but I was wondering why I'm talking, I guess. I'm gonna take the first one, and this might beat me to it. Um, you mentioned there needs to be more studies on like low carb, ketogenic diets, everything. Do you know any that's going on, or has there been any done yet?
I have not seen any low carb interventions on children with obesity. What has been looked at a little bit is and this was actually in the SMHP's position paper, we discussed this, but there was basically a group of over 300 children with it was not just children, but it did have some children in that group who have type 1 diabetes, and they had managed to get a normal A1C. So that's even more difficult than, say, if someone has prediabetes or type 2 diabetes as a child, but they were able to do that using a low carb ketogenic approach. And so that is very exciting, and we need more interventional studies, and we need other groups. So if someone out there is listening and they are in the position they could start a clinical trial and get something like this going, I think that would be really good. Maybe you could do a head-to-head trial comparing a low carb approach to a traffic light diet.
Yeah, I don't think that would be a bad idea to do a trial like that, because I honestly think giving a low carb or ketogenic diet a try in a trial like this is a lot safer than just going, doing a surgery or something extreme like that.
Yeah, exactly. And I think that's why to me, when the AAP came out with their position statement saying that, hey, you can use a low carb approach in adolescence, but you have to get 14 blood works with 5 different lab draws in the first year. If I told a mother that, and if I told myself that as a mom, hey, you could try this diet, but we're really concerned about nutritional deficiencies, so we have to draw your kid's blood 5 times, they're not going to want to do that. I wouldn't want to do it. And so they medicalized it and made people I'm like scared of it basically. But we look at the foods that you can consume on a low carb diet and the nutritional density, the things that they're concerned about. One example was carnitine. Literally, carnitine primary source is meat, and you can eat as much meat as you want on a low carb diet. So a lot of the concerns that they brought up in that paper, which unfortunately is coming from the American Academy of Pediatrics, is what the pediatricians are going to be seeing. A lot of those concerns were unfounded, and they unfortunately did not have really anyone on that paper who had been practicing low carb and understood what a low carb diet for metabolic health looked like. And a lot of the issues is they were conflating some of the concerns from a classic ketogenic diet that was originally used for epilepsy, where sometimes they would even take the amount of fat from the diet up to 90%. And in that 90% high fat diet, where you're only getting 10% of calories from protein or carbs, you do have to worry and be a little bit more cautious and just monitor certain things and maybe supplement things as well in that type of diet. So that's where the paper really went wrong, is they were looking at the wrong nutritional intervention.
I, I had got a question that said, why is it MAFLD and not NAFLD?
So it used to be called non-alcoholic fatty liver disease. Then they changed it to MAFLD, or actually MASLD. where it's metabolic associated steatotic liver disease, which steatosis literally just means fat. And so they changed the name because it's not, the emphasis is not that it's not from alcohol, but the emphasis is that it is associated with metabolic health. Yeah, good question.
I'm not sure if you can see the comments. There was
Yeah,
one. Yeah.
let's see. Addiction transfer was something they required before bariatric surgery for psychiatric visit to discuss stress management. Yeah, so that is something that's super important. And addiction transfer, which is very possibly, and I think bariatric centers are getting better at this, but is not always done, where they are trying to help people who potentially are using food previously as their addiction. Basically, after bariatric surgery, they no longer can use food as their coping mechanism or as their way to de-stress. So now they transfer that addiction to food that they can no longer have to another substance. And that's where the alcohol or the other opioids or other drugs potentially are now acting as a replacement for that food addiction. If a bariatric patient does not learn new coping mechanisms, then they very often lapse and fall back into poor eating habits or turn to other addictive substances to get the dopamine hits that they no longer get from eating. Yeah, but I totally agree with that. So that's, you really need to try to help and work with people to find something to replace the food addiction.
I didn't put it in the chat, but I was going to say if anybody, I did put if you had any questions, throw it in the chat. But also, if you want to just ask Dr. Laura the question, you can hit the raise your hand emoji, and we'll call on you. Before anybody does that, I did have it. I know I'm taking all the questions here, but
Go for it.
you know early in your presentation you had talked about the plant-based days that they've incorporated in schools, and
Yeah.
I don't think I caught it. How long have they've been doing that, and have they followed up and did anything like gave any data proving that it was doing any positive or negative things?
I am not aware yet of any data published from the school systems, and they have been at least offering vegan meals since 2022. I do not know if they have, if that they had exclusively gone to vegan food at that point on Fridays, or if now it's just exclusively vegan on Friday, or if, yeah, if that's been going on. I'm not sure. It's a good question.
Yeah,
Um,
I think it's kind of scary, honestly. Like, you'd think 2 years into something like this, they would be trying to do something to um keep it going, but it almost sounds like they don't have nothing. It's like they was able to slide it in there, and it's nobody's like questioning it or asking.
yeah, and I also think it's a little bit, I mean, part of my concern too is they've got vegan Friday, vegetarian Mondays. Are they going to create a new thing for Tuesday and then Thursday? And it's just going to kind of continue because that's what's being pushed. And so maybe just doing it one day a week, that's actually not an issue. There's not, you don't have to worry from a nutritional perspective. But if that continues and there's more days, maybe that will be a problem. And then the other thing, kind of looking at their menu options, is again, if a kid for is choosing chocolate milk with oatmeal and then they also get some canned fruit, you can imagine the blood sugar roller coaster that kiddo is going to be on. And then the other concern, which this would be really hard to catch in a study, but there is some association and that iron deficiency can increase ADHD symptoms as an example. And so maybe some of the kids who have ADHD or are borderline, they start to have some symptoms of it. Maybe all of a sudden they start manifesting it a lot more. And how could you prove that that was really coming from implementing a vegan diet? That would be really hard in a study, especially just kind of following kids forward like that. So it could be done, but it would be tough. So I think it's, again, it just doing it's kind of like the dietary guidelines that were implemented back in the 70s, where they all of a sudden recommended a low fat diet for all of Americans. And where has that gotten us? So it was a huge experiment they did on our country that led us, unfortunately, really down a bad path. And I feel like that's kind of what's happening here now with pushing a plant-based diet on our kids. It's just another nutritional experiment.
And I found it interesting, like the one you had mentioned the one study where they said they didn't recommend a vegan diet. Was it for the first 2 to 3 years
Mhm.
of life? And that made me think, then when would it be? Like, why would it, if you can't do it the first 2 to 3, what makes it better at 4, 5, 6? You know,
That is a wonderful question. I mean, one thing that you'll consistently see in vegan studies, and this is true, and they showed it in the vegan twin study that happened recently, is that a vegan diet does lower LDL. And so therefore a lower LDL equals lower risk for heart disease, and therefore we're helping people. And that's where it's taken basically. In the twin study, they said, hey, vegan lowered LDL, therefore vegan is better. But that's they didn't have a ton of other data to actually support that the vegan diet was better in that study. But it's just been harped on, if we lower LDL, that is better. And so I think that is where I'm totally with you. If it's not healthy for the 2 and 3 year olds because they're not getting adequate DHA, adequate iron, adequate zinc, then as a teenager, I also want adequate DHA, adequate iron, adequate zinc. And so at what point do I no longer want to have those things in adequate amounts? Never.
yeah.
So that's my take. And again, you can eat a vegan diet, you can eat a vegetarian diet and be healthy. I'm not saying that you can't, but you really do have to be more cognizant about your supplements. And even people who are eating a low carb diet, with now just our food is nutritionally deplete compared to where it was decades ago. You'll see people still have nutritional deficiencies and sometimes taking supplements, and that's okay. But overall, you're much more likely to see more deficiencies and more risky deficiencies with the vegan or vegetarian diet.
I see a question. I think it was Nick
Yeah,
Norwitz recently do a vegan study on his LDL and found going vegan raced it.
you are correct. You got me. So vegan diets almost always lower LDL, but not always. So Nick Norwitz, he's a lean mass hyperresponder, and when he is on a ketogenic diet, his LDL goes up significantly. And even eating a vegan low carb diet, he maybe had vegan Oreos. Yeah. So when he added the Oreos, that actually dropped his LDL. But when he was eating the vegan diet, he was still consuming very large quantities of fat, even though it was vegan, and his LDL did indeed go up.
So
Yeah.
I think we just answered a question I'm not sure if even Nick knew. So it sounds like the the regular Oreos are better for you than the vegan Oreos if they raise the LDL.
Right. Yeah. Yep. I think all Oreos are vegan, isn't that right? Or maybe they're
Um,
just vegetarian.
I think I could be wrong. Don't quote me on this. Like, I think I did see like vegan or vegan Oreos. I think maybe there's a little milk or something in the original ones.
Okay. I have not looked at a package for a while for those, but I can
I
believe that.
haven't either, so you
Yeah. Um, yeah, it's kind of like you'll see on packages like a pure meat package and it says gluten free, and I'm like, why are you telling me this is gluten free? It's pure meat. But anyway, I digress. Um, other questions? All righty. Well, I think if there's no more questions, I'm gonna go enjoy myself a ribeye and gonna call it a day.
I think thanks for that. That was a excellent presentation and very interesting. Hadn't seen a lot of that put together like that before.
Awesome. Well, thank you. I had fun researching and reading through all of those. So thank you again, everybody, for joining. Always great to see some familiar faces in the crowd, and hope to see you next time.
Let's see, guys.